Artificial disc replacement for the lumbar, for your low back. It's a bigger operation than one for your neck. So what's the recovery like for that? It's a lot further reach inside. Remember, artificial discs are placed through the stomach. So we have to go around your intestinal area to your spine. Sounds horrific. I've had 2 approaches this way. I'm fine. What's the recovery like? When we do an artificial disc replacement in the lumbar spine, that disc is really healed in by 6 weeks. And at 6 weeks, I return you to full physical therapy and functional activity. The soft tissue healing is really 2 to 3 weeks before the muscles and the soreness are essentially gone, and we're able to rehabilitate you. And then I really let you stress load those discs at 6 weeks. And for the next 6 weeks after that, to get you to 12 weeks, you should feel really great. And by 6 months, when I had my 3 disc replacements in my low back, I felt amazing. So I would say 6 weeks and you're back to full activity and functional levels.